All right, let's talk growing pains versus injury. I think that's a really common question we get as pediatric therapists all the time. Is this just growing pains, or did my child actually hurt themselves and we need to consider some PT or a brace or some support? I'm Kelsey Baas, pediatric physical therapist and founder of Compleo Wellness. The first thing is I want you to always take your children's pain seriously. There's lots of different causes for pain, and I promise you they're not making it up. Now, if we're thinking it's growing pains, it might wake them up in the night and it should go away pretty quickly. So it shouldn't be something that's lasting weeks or days. Anything that has a recurring pattern, we want to talk to a doctor or PT to address. So growing pains might be if you're going through a big growth spurt and you might have a little bit of soreness and they might wake up a little bit tight, especially as they go through those big growth spurts. Our long bones grow faster than our muscles, and so then we can get some tightness in like our calves or our quads or hamstrings. That can cause a little bit of pain, but it should work itself out relatively quickly. So what are some signs that we should get our pain looked at? Anything that is happening on a recurring basis, longer than a week, something that keeps going on and on. Of course, if there's an injury, we knew they fell really hard or jumped off something really high, then we definitely want to look at something pretty quickly. And then if something's interfering with what they want to do on their day-to-day life, and this goes for all ages. If people are trying to decide, do I need to do something about this pain? Is it keeping me from doing what I want to do? Are they sitting out of sports, choosing more sedentary play, avoiding certain movements? Then it's definitely something that we want to address. Some really common things that we're going to start to see with kids as the school year goes on, especially boys and especially in kind of those elementary years where they are having those big growth spurts. If they're complaining of a lot of heel pain, that's something we want to take seriously. It could be something called Sever's disease. Is when the growth plate pulls off a little bit. So if they're complaining of heel pain and you do a gentle squeeze on their heel and that increases their pain, that's something we want to have looked at called Sever's. Something else that can happen when they grow really quickly is Osgood-Schlatter's. That is where some patellofemoral pain can happen at the tendon insertion right below the knee. That can start to pull at that insertion. So if they're having a lot of knee pain, we want to rule that out. If it's happening with activity, it's most likely something musculoskeletal that we can treat. And again, if you go back and watch our video about single sport specialization, you're going to know we can avoid a lot of these injuries if we avoid single sport and make sure our kids are getting adequate rest, adequate hydration and nutrition, and encouraging multiple movement patterns so we're not overusing one thing. But injury is sometimes unavoidable, especially with active kids. And so when that happens, we want to, one, take their pain seriously. Two, if it's lasting longer than a couple days or a week, seek out professional help. And then three, follow the advice of the professional help. If they say rest or sit out of the game, you need to rest and sit out of the game. If they say stretch and strengthen, we need to stretch and strengthen. So find your local PT that specializes in kids, and don't be scared to call them for a checkup, just like you would a medical checkup if your kids are starting to have those aches and pains. Follow us on Compleo Wellness for all things kids and family wellness that grows with you.